It only took one patient with coronavirus to walk in the door, and now 15 frontline emergency department staff at Brisbane's Mater Hospital are in forced isolation, unable to work.
Now, this group of staff members are Queensland's first health officials to be forced into quarantine after dealing with a coronavirus case. Mater Hospital says it's a precautionary measure.
It's not good enough that our frontline staff, that our nurses, are bearing the brunt of this, and it's their health and well-being that are put on the line without the protection, and it's then them that are going to take it back to their family. It's totally unfair.
The Nurses Professional Association of Queensland is concerned more of its members will be ordered to stay home and be forced to use their accrued sick leave.
A lot of misinformation and confusion out there at the moment about whether nurses should be taking sick leave or not. For our members, get in touch with us. If you have been in close contact and you've been stood down, get in contact with us. Don't just assume that you should take sick leave. In many cases, it can either be a work cover claim, or they should be directing you to work from home, and you continue to get paid as you would otherwise.
If someone's been sent home at the employer's initiative and the worker hasn't applied and doesn't have a medical certificate for sick leave, then it cannot be sick leave.
Last week, staff at 3 Vodafone stores in Perth were told to go home after a worker was tested for coronavirus. Clayton Utz, one of the country's biggest law firms, sent its entire staff home from its Sydney office. Industrial advocate Miles Heffernan says workers can't be forced to use their accrued sick leave if their boss tells them to stay home because of coronavirus concerns.
A boss can't tell you just to go home, and if they do, and you're on a full-time or a part-time arrangement, you deserve to get those hours. And equally, if you're a casual and you have got a predictable set of hours, or you knew your shifts that you were going to have and they were ripped from you because of some boss with an imaginary concern, or a boss that hasn't appropriately assessed their risk, then that's either discrimination or adverse action.
This week, the government is set to announce strategies to reduce the impact of COVID-19 on the Australian economy. Shadow Minister for Health Chris Bowen spoke to David Spears on the ABC's Insiders program about the need to support those who can't work, in particular casuals who lose shifts and don't have paid sick or carers leave.
Yeah, if you've got enough sick leave, great, but if you don't, or if you are a freelancer, a casual, whatever it may be, work in the gig economy, you're going to lose income, right, for those 2 weeks?
Yes, and that's something the government needs to concentrate on very quickly. We're not saying that there's only one answer here. We're saying they should sit down.
Should they get New Start or something? Or
that's one option. That's one option.
One that you would support?
Well, certainly we would support any sensible steps here to support casual workers.
And is that a sensible step? Sorry, I'm just trying to get an answer.
Well, David, it's up to the government to put a solution forward. I mean,
what's your view, though? Should New Start be paid to those who lose income during self-isolation?
That's one option that would work, but I'm not going to be prescriptive and say it's the only option. We'd support any sensible options here to support the workforce and those impacted, whether directly or indirectly.
With the question of casuals, it's the but-for test. But for this act of discrimination, but for this act of a presumed impairment, would they have got the shifts? If the answer to that is yes, then that is direct discrimination on a presumed impairment.
Any NPAQ members or nurses out there who have been stood down, get in touch with us. It's vitally important you have the right information. Don't just assume that you take sick leave. You should be potentially looking at work cover claims. So don't give up your workplace entitlements without speaking to us first.
Bottom line, workers being sent home should be being paid, and if they are not, they should get some advice.